Hello friends, welcome to our YouTube channel Nursing Essentials. So today we are going to learn about acid base imbalance, and friends, this is very important topic from exam point of view. Either it can be in ORSET or NCLEX, every exams the questions are asked from acid base imbalance, and I assure you after watching this video you will be able to solve acid base imbalance questions. So friends, let's get started. So firstly, we need to remember the normal values of pH, CO2 and HCO3. The normal value of pH is 7.35 to 7.45 and PaCO2 normal value is 35 to 45 and HCO3 is 22 to 26. Or some books you also say that the value is 22 to 27, but I would like to tell you that this is the right value, and I also searched from many platforms that this is the right value. So let's talk about, there are the four types of acid base imbalance: respiratory acidosis, respiratory alkalosis, metabolic acidosis and metabolic alkalosis. So friends, there are also three types on the basis of compensation. The first is fully compensatory, partially compensatory and uncompensatory. So we will learn in this video about the upper four types, and these three types we will cover in next video. So friends, here you can see if the pH is less than 7.35, then we say it is acidosis, and if the pH is more than 7.45, then we can say it is alkalosis. So you have to remember the trick, that is ROM. ROM means respiratory opposite and metabolic equal. Respiratory opposite means the relation between CO2 and pH is opposite in case of respiratory system, and we are talking about the metabolic, then the relationship would be equal. Like if the CHCO3 is increasing, means pH would be also increasing, but in case of respiratory, if the CO2 is increasing, means pH would be decreasing. So if we remember this technique, and the questions will be easily solved. So I would also recommend you to remember this technique so that you can easily solve, or you can find out whether it is metabolic condition or a respiratory condition. So we talk about in detail about every condition. So friends, first of all we are going to talk about respiratory acidosis. It occurs due to accumulation of CO2 in lungs, and when it combines with H2O, it makes carbonic acid, means thus it lowers the pH of blood and causes acidosis. Friends, we generally see whenever there is accumulation accumulation of CO2 in lungs. For example, if there is any respiratory condition in which the patient's lungs are not able to expel out CO2, at that time the CO2 is accumulated in lungs and it causes respiratory acidosis. So friends, if there is a ABC analysis, and in ABC analysis we will see that the respiratory, in case of respiratory acidosis, the pH would be decreasing because we are talking about acidosis, and CO2 would be increasing because we are talking about respiratory conditions. So the CO2 the value would be more than 45 and pH value would be less than 7.35, and SCO3 would be normal because it is respiratory condition, so the bicarbonate level will not be affected. So this is usually occurs in respiratory acidosis. If we talk about the causes, then this can occur in airway obstruction, neuromuscular conditions in which the central nervous system affect, due to which the respiratory center will also be affected, CNS disease, central nervous system disease, or COPD, chronic obstructive pulmonary disease. And if we talk about the sign and symptoms, the patient will experience dyspnea, tachypnea, restlessness, cyanosis and confusion, as this occurs usually in case of respiratory conditions. And the restlessness is also the patient suffer, and cyanosis due to the decrease in oxygen level in body, and confusion when the brain will not get enough oxygen, then it will occur. So these are the common manifestations. And the treatment that is given in respiratory acidosis is oxygen administration, as we see that the CO2 was accumulating in respiratory system, so oxygen would be administered. Suctioning, if there is any secretions the mucus or something is obstructed the airway, at that time suctioning would be preferred. Intubation and mechanical ventilations in case of severe condition. Deep breathing exercise would also be promoted, and bronchodilators are also given. So friends, if we talk about the exam point of view, when then the values are given, the questions is given in this type. The questions would be like the pH is given, for example 7.330, and the CO2 value is 50. Then we will see that the pH is less than normal, because our normal is 7.35 to 7.45, so it is less than. So and here we can see the CO2 is more than the normal, because normal level is up to 45, so it is more than. And the same thing that we see here, the pH is decreasing and CO2 is increasing, means the relation is opposite. Here it is decreasing, here it is increasing, means opposite. This is respiratory acidosis. Opposite means respiratory, and pH low means acidosis. So these conditions would come out be respiratory acidosis. So I hope you are understanding about the respiratory acidosis. So friends, let's talk about the second condition, that is respiratory alkalosis. So friend, this condition occurs due to hyperventilation, or we can say washout of CO2, or due to which the CO2 will be decreasing in the lungs, and thus the pH is increasing, means the condition is alkalosis. If we see ABC analysis, then the pH would be increasing, means more than 7.45, and CO2 would be decreasing, means less than 35, and SO3 means bicarbonate would be normal. So in this condition we will see it is respiratory alkalosis. If we talk about the causes, then the anxiety, fear or pain, or in case of respiratory center stimulation, means the respiratory center is stimulated and there is a hyperventilation, due to which the low level of CO2 in lungs. And if the patient is on mechanical ventilation, at that time also there is a risk of respiratory alkalosis. So these are the main causes of respiratory alkalosis. The clinical manifestations are breathlessness, dizziness, numbness and tingling sensation in fingertips, fatigue and muscle spasm. And the management is sedatives are given, because the CNS or central nervous system is overstimulated, means we will provide sedatives and tranquilizers to lower down the hyperventilation or decrease ventilation rate. If the patient is on mechanical ventilation, our first priority would be decreasing the ventilation rate. Rebreathe in paper bag, this technique also helps to restore the level of CO2, as the CO2 level is going to decrease. So if the patients will rebreathe, then the CO2 will be inspirations during CO2, so it will also help to increase the CO2 level. And if the patient is experiencing pain, then the pain management would also be priority. So if we take the example, then the pH is 7.50 and CO2 level is 29. It means pH is more than normal and CO2 is less than normal. So the relation is opposite, means the condition is respiratory, and pH is increasing, means the respiratory alkalosis. So in this way we can learn about respiratory alkalosis. So let's move to the third condition, or the metabolic acidosis. It occurs due to acid accumulation or bicarbonate loss from the body. Means acid accumulations means the acidity would increase, like acids in the blood would increase, and the SO3 level would be decreasing. So the condition is would be metabolic acidosis, as the relation is equal. And we also learned in the Rome technique that the relation is equal in metabolic. So as we can see that the pH is decreasing and SO3 is also decreasing, means the condition is metabolic acidosis. So let's talk about the causes. This condition usually occurs in case of diarrhea, kidney failure or alcohol use. And the main clinical manifestations are nausea, vomiting, loss of appetite, tachycardia and headache. And if we consider the treatment options, then the sodium bicarbonate is given, because as we can see that carbonates are decreasing, so sodium bicarbonate would be preferred, and advised to stay hydrated to prevent it, because if the patient will drink water, then this will also help them to make bicarbonates. So the advice is given to stay hydrated. Blood sugar level would also be assessed. The example question is the pH is 7.29 and SCO3 is 19. As we can see that the pH is less than normal and SCO3 is also less than normal. The normal level of SCO3 is 22 to 26. It means this is not less than normal. So we can see the relation is equal, means metabolic equal, and it is metabolic acidosis condition. The last one condition is metabolic alkalosis. This occurs due to increased bicarbonate in blood and increased pH. You can see that the pH is increasing and SCO3 is also increasing. Means pH is more than 7.45 and SCO3 is also more than 26. So the PaCO2 would be normal. The cause of these conditions would be vomiting. Generally the questions are asked that the what condition occurs in vomiting, so you have to remember the metabolic alkalosis that is caused by vomiting, because like the stomach contains lots of acids, and during vomiting the acids would be eliminated from body and the acids would be decreasing, means base would be increased, means pH would increase. So, and in case of diarrhea, like the bicarbonates are removed from the body, means bicarbonates would be decreasing and pH would be decreased. So means you have to remember, in case of vomiting metabolic alkalosis occurs, and in case of diarrhea metabolic acidosis occurs. Other causes are gastric aspiration, means lavage. If we are removing the gastric contents of a patient, at that time also there is a risk of metabolic alkalosis. And cystic fibrosis is also a condition that cause metabolic alkalosis. If we comes to the clinical manifestations, then the patient may experience tremors, muscle weakness, or hypocalcemia and hypokalemia. Let's talk about the treatment. Then IV fluids are given, in which 0.9% NaCl or normal saline is given. Diuretics are also preferred. As we can see, the bicarbonates are increasing in body. So if we give that diuretics, then diuretics will help to eliminate the SCO3, or we can say bicarbonates. So this thing also helps, and potassium replacement is also helpful. The question is asked, or example is given, that the pH is 7.51 and SCO3 is 29. Means pH is more than normal and SCO3 is also more than normal, as normal is up to 26. So it is at 29, means more. So in these conditions, the condition is metabolic alkalosis. So friends, these were the 4 conditions. Now we are going to solve some questions about acidosis and alkalosis, like usually asked in the exam. In first questions, you can see the pH is 7.56 and the CO2 is 20. Means you can see the pH is more than normal and CO2 is less than normal and SCO3 is normal. So friends, you need to give the answers in comment box, so that you can revise or you can interpret the conditions that you learn, and this thing also helps to like understand more the concept. And second question is pH is like less than normal. As you can see, 7.29 PaCO2 is normal because it is between 35 and 45, but here you can see the SCO3 is less than normal. So you need to remember what would be the condition. And in third questions, the pH is also less, CO2 is more than normal and SCO3 is normal. So you need to give the answer that whether it is metabolic, respiratory, acidosis, or alkalosis. Okay, so the last question is pH is 7.48 and CO2 is like 41 and SCO3 is 30. Means here you can see SCO3 is more, CO2 is normal, but pH is more. So you need to also interpret whether it is metabolic alkalosis, acidosis, or respiratory acidosis, alkalosis. You will find the answers of these questions in the comment box, so you can match your answer, and you also give the answers of these questions. So friends, this is all about acid base imbalance. So again, we are going to revise the normal values like 7.35 and 45 between, and CO2 is 35 to 45, SO3 is 22 to 26. There are the four conditions: acidosis, alkalosis, metabolic or respiratory. These three types we will learn in next video. pH, as you all know, that acidosis is less and alkalosis is more. The technique that is important, trick, the ROM, respiratory opposite and metabolic equal, means PO, CO2 and pH relation would be opposite, and here the relations would be equal. As in respiratory acidosis, we were seeing that the pH is low and CO2 is more. In case of respiratory alkalosis, you can see the pH is more and CO2 is less. In case of metabolic acidosis, both the things are less than normal, SO3 as well as pH. And the last one, that was pH is more and SO3 is also more, so it is metabolic alkalosis. So this is all about acid base imbalance, and please give the answers of these four questions in the comment box. Thank you for watching.